Hello everybody, welcome back to my channel. Dr. Yogi here, and it is so good to see you and be amongst the presence of what? Greatness, because you are great. Today's video is to talk about how I did on my week of nights in the hospital. Let me tell you, I am not a night person, and your girl about died. I was tired, you understand me? Tired after that. My sleep pattern is still jacked up, but that's okay, because make sure we're taking care of our people. That's all that matters. So if you're interested in see how that went, stay tuned. Let's get into it. I arrived to the hospital around 5:30 p.m. and go in through the back entrance. At that point, there is someone down there who checks our temperature to make sure that we are not having a fever. If you are having fevers, you are not allowed to come into the hospital. Once you pass that, they give you a mask, and then you can proceed to whatever daily duties or nightly duties you are responsible for. By this point, I usually go to the cafeteria and get my night snacks. The cafeteria usually closes around 10:30, so after that, you're pretty much figuring it out on your own. You can order in or whatever the case may be. So I get my snacks, get my coffee. I go up to the 6th floor of the hospital. That is where our resident room is. At that point, we have a sign out. I print my list so I can see all the patients and all their problems and all their plans. And we commence doing a sign out. Sign out is when you do a transition of care conversation. So you say, hey, this is a 67-year-old patient who has a history of this, this, and this. They came in because of this. Clinically, this is how they've been doing over the last couple of days. The biggest things that we need you to follow up on are checking this lab or following up on these vital signs. It's pretty much a way to say, this is what's happened with this patient, this is about this patient, and this is what we need you to follow up on overnight, or what we anticipate that may happen overnight, just to kind of give you a heads up. After the sign out, which can last about an hour, hour and a half, depending on how many patients are on the list, we proceed to round on the more sick patients. That way we have a baseline. My intern and I will go into the various rooms, the ICU or the step down, which is a step down from ICU. And we will evaluate those patients so we can have our own interpretation of how they looked at the beginning of the night. This is really critical in case something changes overnight. You know what the patient's baseline was prior to the change in their health or the change in their acuity. After we round, we'll go back up to the resident room, finish our notes, follow up on labs, and we do that until we are called in for an admission. Admissions come any time of night. They can be, from people who have bleeding inside their GI tract. It could be people who have elevated blood sugars, or what we call DKA, diabetic ketoacidosis, which is where your sugars are so high you need to be on an insulin drip to help get them down. It can be people who've had trauma, anything. When we get a call for the admission, we chart review, get all the vital labs, all the vital imaging, EKGs, all of that, and then we will go down and see the patient. In the time of COVID, we are doing things a little differently, where if someone is concerned that a patient has coronavirus, we will call into the room and talk to them and get the history. So that way, all we have to do when we physically arrive to the room is do our exam, come out, and then put in orders. After we get them tucked in, we can go back to the resident room and continue to follow up on labs, including the new labs that we have ordered for our new admissions. So this is our resident room. This is where we do our sign out. This is just an extra computer room. Yeah. An additional computer with our handy dandy microwave. Our printer / fax machine. There's some offices back here. And then our call room. Other things that can happen overnight is sometimes you can get consults, medical consults, where a specialist like an orthopedic surgeon is asking for you to come in and manage the medical problems of their patient. So you go and you do the same thing. You chart review them, you see what medications they're on, what chronic problems they have, and then you go and talk to the patient, get their history, make sure everything is okay, and then you restart medications that need to be restarted or that the patient can tolerate. Sometimes there can be a little more exciting things that happen overnight, which is a plus or minus. I know I'm not an inpatient person. I don't really see myself doing inpatient medicine in the long run, which is why I did family medicine. So I'm okay with not too much excitement personally. But you can have things like if a patient has a rapid response, meaning that there's something going on with their breathing or there's something going on with their heart rate or anything with their vital signs that is not the norm, you can get a rapid response and you can go and evaluate for that. Or you can get a call that says that a patient fell. You have to go evaluate them and see if anything is wrong from a neurologic standpoint. And then finally, of course, you can get something like a code. A code is where the patient's heart has stopped and you have to resuscitate them doing compressions. Always compressions first, guys. If you ever see somebody down, start with compressions. You tap them to say, hey, are you okay? Are you okay? If they don't respond, you don't have a pulse, compression. So nights can be a little busy, and they used to be a lot more busy when we were seeing OB patients as well. So our program, our residency program, when you're on the inpatient night service, you handle both OB and you handle like the medical patients that are on the floor. Things changed with coronavirus because of the fact that we didn't want to expose our pregnant people to any unnecessary coronavirus because we've been dealing with patients who could possibly have it. We don't have the test result back, so on and so forth. So then we just split that off for the time being. So our medicine service at night only deals with our medicine patients now.
Gimme. It's the last night. All right, we doing good. We made it. I'm happy. Hey.
So then we pretty much wrap it up in the morning. We have the day team come back and we do another sign out or transition of care conversation. And we let them know everything that happened overnight, and we let them know about any new admissions or new consults that came in. And then from there, they take the mantle and we go home, go to sleep, and start it all over again the next day. So that's pretty much night float in a shell. So that wraps it up for my week of nights. I'm so happy that is over. But if you are interested in things like that and you want to continue to follow me on my journey, then don't forget to subscribe because there'll be more content coming your way. And I will see you in the next one. Bye.